Mr. Speaker, today I stand before you as a proud Guyanese public servant, honored to be part of this coalition government, which recently presented a national budget after 8 months in power, indicating that this government will continue to deliver contagious progress and that the budget is primarily designed for the people of Guyana. Yes, Mr. Speaker, under the astute leadership of President Granger and under the guiding, capable hands of the Finance Minister, this economy is cooking with gas. Yes. This economy is firm on two strong legs, and by extension, this economy is headed in the right direction. At this significant moment, I take this opportunity to both encourage and challenge us to keep converting better into best, as together we dance with economic vibrancy. Indisputably, one can emphatically state that Budget 2016 is the Guyanese people's budget. Once again, our Honorable Minister of Finance, Honorable Minister Winston Jordan, has crafted a budget that will bring about tangible relief to and opportunities for the working class people of Guyana. The rank and file, the masses, the ordinary man and woman will benefit great measure from Budget 2016. It is clearly evident, Mr. Speaker, that this APNU-AFC government is determined to invest significantly in human development as a strategic approach to providing a good life for all Guyanese. Investing in the education and health of a nation is to essentially empower and build capacity of its people, ensuring that they are healthy so that they can contribute meaningfully towards nation building. The 28 billion Guyana dollars, an equivalent of 10.9% of the national budget, has been allocated to the health sector, demonstrates the unremitting commitment of this APNU-AFC government towards ensuring that best quality healthcare services are provided across the length and breadth of Guyana. Mr. Speaker, a number of areas within the sector will be significantly improved, with greater emphasis being placed on regularizing the procurement procedures, leading to a more efficient and transparent model, as well as working assiduously with other stakeholders to address suicide prevention. Mr. Speaker, this approach is grounded in compassionate economic practices. As the Ministry of Public Health does not chase symptoms, we solve problems. Health promotion will also form a big part of what we do this year at the Ministry of Public Health. Moreover, it is also imperative that we significantly reduce the maternal mortality rate. Mr. Speaker, the Ministry of Public Health is set to promote healthy lifestyles through persuasive integrated communication campaigns, utilizing all forms of media to get key messages of healthy living and its benefits to all the people of Guyana. Mr. Speaker, I can guarantee that with this significant injection of financial resources from Budget 2016, the public health sector in Guyana is poised to make a greater impact on the health and the well-being of the people of this beautiful country of ours, thus realizing the theme of stimulating growth, restoring confidence, the good life beckons. Mr. Speaker, it is commendable indeed that the senior minister in the Ministry of Public Health and yours truly have set an admirable teamwork model to lift and uplift the achievements of this coalition government in the area of public health. Mr. Speaker, our approach is simple but profoundly impacting. we plan to accomplish the following: to streamline public health, to expand regional development, to increase maternal and child health care, to downsize teenage pregnancy, to revitalize good nutrition, to reduce the prevalence of non-communicable diseases, and present the tobacco bill to the Parliament, to fix the procurement challenge, to minimize the spread of Zika virus in Guyana, and to overcome suicide amongst us. Streamlining the public health sector, a work in progress. Mr. Speaker, the public health sector is in the process of being reformed through a number of strategic interventions that have been crafted to realize national goals. In an effort to restore confidence among stakeholders within the public health sector, deliberate efforts are being taken by the Ministry of Public Health in all aspects of public health care to improve its quality as well as its delivery. We at the Ministry of Public Health will be making a number of systematic changes to primary care practices and public health systems to improve the quality, efficiency, and effectiveness of the patient care we provide. Mr. Speaker, it is the moral responsibility of a caring government to ensure that all the people are provided with proper health care. Thus, the Ministry of Public Health has embarked on such a course. Regional development. The Ministry of Public Health is working assiduously at standardizing the quality of healthcare services provided at all its healthcare facilities throughout Guyana. Mr. Speaker, at the Ministry of Public Health, we are determined to provide the best quality universal healthcare and to narrow the gaps of inequality in Guyana. Mr. Speaker, this year's budget will greatly assist in the realization of this important goal. Every health post, health center, district, and regional hospital will be adequately staffed with competent human resources and be sufficiently stocked with required pharmaceuticals and medical supplies. Regardless of the nature, any obstacle to achieving the aforementioned, I can assure you, Mr. Speaker, will be removed with alacrity. In a few weeks, the senior management team will be meeting with the regional executive officers and the regional health officers to ensure that we align our efforts and work together in a synchronized manner to achieve the goal of delivering the best quality health care possible to Guyanese. Mr. Speaker, we are currently building capacity in all the regions so that it will not be necessary for patients to have to travel to Georgetown for medical care. And with the new standard treatment guidelines, the quality of healthcare services provided in each of the regions will be enhanced and unquestionable. Mr. Speaker, Budget 2016 will also be an integral in making the standardization process a reality. In Region 1, there is a brand new state-of-the-art hospital being constructed at Port Kaituma. This hospital, Mr. Speaker, will be fully equipped with the latest and best medical equipment and will serve as a model for quality regional health care. Mr. Speaker, the new Port Kaituma Hospital will house male and female wards, a fully functioning world-class operating theater, minor operating room, maternal child health care facilities, dentistry, laboratory, infectious disease center, pharmacy, radiology department, and modern storage facilities. The cost of the new Port Kaituma Hospital is pegged at $700 million Guyana dollars. The contractor is R. Basu and Sons, and the supervisory consultancy firm is Caltech Inc. The commissioning of this new facility is scheduled for December 2016. Maternal and child health care. Mr. Speaker, we at the Ministry of Public Health are cognizant that there is a definite link between maternal health and newborn survival. While great strides have been made in reducing global child mortality, here in Guyana, we still have some preventable challenges with which to deal with. Each year, newborns and sometimes pregnant mothers needlessly die as a result of a variety of reasons. Mr. Speaker, we are aware of the main causes of maternal mortality, and we have placed a menu of measures in place to treat these causes. Mr. Speaker, while the government has devoted additional resources in the tune of $89 million towards the expansion, rehabilitation, at the level of our only tertiary and referral health institution, efforts will be made at the level to encourage, maintain, and equip the maternal child health facilities countrywide. The Ministry of Public Health has embarked in training and retraining of maternal staff, inclusive of the traditional birth attendants, which we normally call nannies. Doctors are also part of a series of training exercises geared to deal effectively with complications due to prematurity, complications during delivery, and complications stemming from infection. Mr. Speaker, we have engaged relevant staff throughout the regions in training emergency obstetric care, advanced in labor and risk management, we call the ALARM program. More than 100 healthcare personnel, including doctors and nurses from all 10 regions, participated in this training in 2015. The Ministry of Public Health will ensure that this training is continuous in a determined effort to better equip medical personnel to deal with obstetric emergencies and prevent maternal mortality. Mr. Speaker, the Ministry of Public Health will deal with professional negligence, condemning when and wherever it occurs. Eliminating mother-to-child transmission of HIV and AIDS. Mr. Speaker, the Ministry of Public Health is consolidating its efforts to accelerate its program to prevent the needless transmission of HIV to infants. Globally, we recognize the success in prevention programs, with the global focus moving now from prevention to the elimination of the transmission of HIV and AIDS. The Ministry of Public Health will provide funds for test kits for the general population and to test all mothers and children exposed to HIV. In addition to the donor agencies providing funds for the treatment of HIV/AIDS, the Ministry of Public Health will be responsible for the procurement of 48.9% of the drugs needed to treat HIV and other opportunistic infections. The Public Health Ministry will increase its activities that focus on behavioral change of persons living with HIV and AIDS through training and retraining of religious leaders, teachers, social workers, and other key influential members of society so they can become advocates of HIV prevention. Mr. Speaker, we at the Public Health Ministry will be intensifying family planning education programs, which are intended to have the much desired involvement of male partners. The programs also ensure that women have the tools and information they need to make informed decisions respecting their own bodies. This information will be shared primarily to prevent unwanted pregnancies among women living with HIV and AIDS. Preventing HIV from transmission from women living with HIV to their infants using ARV prophylaxis is also a measure that will be intensified. Pregnant women living with HIV and AIDS will also be placed on ARV prophylaxis or highly active antiretroviral therapy, depending on their individual level of immunity. Reducing teenage pregnancy. At the Ministry of Public Health, Mr. Speaker, we will continue to address robustly the issue of teenage pregnancy. Pregnant teens would continue to benefit from our comprehensive teen-focused prenatal and antenatal care programs. The ministry will continue with its antenatal clinics for teenage mothers with emphasis on teen-focused programs that address issues such as increasing the use of contraception to prevent subsequent pregnancies. The programs will also provide nutritional counseling teach parenting skills, encourage continued education, and identify available resources. Non-communicable diseases, as we know it as NCDs. Mr. Speaker, according to a report from the PAHO WHO, NCDs, particularly diabetes, cancer, cardiovascular diseases, chronic respiratory diseases, are responsible for 78% of deaths and 76% of premature death in people 30 to 69 years of age. The Ministry of Public Health will be engaging in a number of cost-effective, high-impact interventions recommended by WHO, which will include reducing and eventually banning all forms of tobacco advertising, replacing trans fats with polyunsaturated fats, restricting or banning alcohol advertising, promoting breastfeeding, implementing public awareness programs on diet and physical activity, and preventing cervical cancer through screening. Through our strategic health promotion activities, the Ministry of Public Health will be engaging in population and individual-based approaches to increase access to education, to promote health literacy in children, adolescents, and parents, and to empower women in tangible ways to reduce and eventually avoid the burdens of NCDs. Mr. Speaker, very soon the Ministry of Public Health will be tabling its tobacco legislation that will be in line with the strongest tobacco control policies around the world. The groundbreaking law will secure some of the toughest restrictions on the distribution, sale, and use of tobacco products currently in place and position Guyana as one of the leaders in tobacco control in the region. Nutrition. Mr. Speaker, our manifesto states that a hungry child cannot learn as well at school. In light of that observation, the Ministry of Public Health will be working along with the Ministry of Education in collaborative effort to provide nutritious meals to school children, particularly those in the hinterlands and other relevant communities. To this end, we have already collaborated with the Ministry of Education, as I mentioned, Blood Center, Caribbean Public Health Agency, CARFA, laboratory in Trinidad and Tobago. Even though this detection was in a single case, the Ministry of Public Health was galvanized into action. As a consequence, the Ministry of Public Health was immediately put into alert mode to ensure that this topical public health concern is kept at a minimum and not contribute to any adverse economic and social burden. Mr. Speaker, the government of Guyana's response to this potential Zika virus threat through the Ministry of Public Health will include the following. In the immediate, we will step up with the Ministry of Public Health Education campaign with the use of all forms of traditional and new media technologies, which include the production of audiovisual materials for radio and television. The production will take the form of jingles, advertisement, infomercials, public awareness messages. Social media will also be utilized, particularly Facebook and WhatsApp, to get short, compelling messages to large numbers of people. Text message blasts will also be employed. In addition, flyers, posters, and brochures will be created and distributed across Guyana. Pro bono television and radio interview programs will be used, and feature articles will be placed in the daily and weekend newspapers. In areas where access to mainstream media is minimal, to be non-existent, loud airers will be used to get message to the people of those communities like in the hinterland. To continue with scheduled fogging in all 10 administrative regions of Guyana. We're going to continue with the distribution of treated nets to the members across Guyana, with particular focus on the pregnant woman to help in protecting them against the mosquito bite. Immediately, we have implemented within the last 2 weeks the spraying of different infrastructure with insecticides to assist in the controlling the vector. And please, if you would like the PPP office in Rob Street to be sprayed, please feel free to ask us, please. To introduce the In2Care mosquito trap as a pilot project, as selected health facilities and ministries across Georgetown will be done during the next few weeks.
Yes, give Barry a copy of the speech.
To sensitize relevant officers at the ports of health. You know, we have our ports at Brazil, we have our ports Ogle, we have Temeri, we have Suriname, And in addition to strengthen the surveillance system at the set ports of the entry to facilitate more public health promotion. That's what we're going to do in the immediate.
Yes.
In the near term now, we will strengthen the health promotion and communication unit at the Ministry of Public Health. Of course, when I went there was none. We have to now create one. We're engaging and work with stakeholders like PAHO, UNICEF, the ministries, inter-ministries like telecommunications, citizenship, foreign affairs, and now resources, natural resources coming on board. We're going to collaborate with representatives from CARICOM and CARICOM states in Brazil. In the long term, we're going to build capacity of health staff at the National Reference Laboratory, including lab technicians, to test and detect Zika virus by using the polymerase chain reaction, or PCR, testing, which is deemed the only reliable test for the virus. So we hope very soon that we can be able to do the test rather than send it to CARPA in Trinidad. As the minister,
Honourable member, you have 5 minutes remaining.
Mr. Speaker, may I move that the honourable member be given 5 minutes extension to her allotted time?
I thank the honourable member. Honourable member, you will speak for 35 minutes.
Thank you, Mr. Speaker. Suicide. Mr. Speaker, with physically large, developmentally Guyana, we're a relatively small country with very small population. Therefore, to consider the beautiful country having the highest suicide rate in the world is frightening as it is much worrying. Our people in relation to our population are taking their lives at an alarming rate. This situation needs to be arrested immediately. Recent studies have shown that the most vulnerable areas and groups, as well as most preferred methods utilized by persons to commit suicide. The government has decided in order to combat this scourge of suicide, a national effort is required and has therefore engaged in a number of ministries. It must be multi-sectoral. It must be, we cannot do it. It's everybody's business.
Yes.
The following are some of the programs and initiatives to be undertaken by the Ministry of Public Health in response to suicide behavior. What we're going to do at the health centers, we're going to develop a protocol to provide guidance to our primary health care workers. We're going to train personnel, capacity building in health centers for healthcare workers and first responders. We're going to provide health centers with social workers and counselors who will visit at least once a week. We're going to improve our health literacy, public awareness campaign, using flyers and brochures. We're going to develop a national trainer of trainers programs, which can then be expanded into the regions. Of course, we already know the hub of activities from statistics would have been region 6 and 2, but nevertheless, we're going to expand it to other areas. We're going to develop an approach where trained mental health workers go into regions. These initiatives can all be established using existing framework within the public health care system so we can lower capital costs. We're going to also use, identify and train gatekeepers, be the policemen or firemen, including the community leaders and religious organizations. We're going to create social safety net programs for vulnerable mental health patients. And of course, we're going to identify support, patient support needed. We're going to create a crisis wellness center. We're going to create youth-friendly spaces and encourage persons to attend the youth-friendly forums and fora. We want to train first responders, as I mentioned before. We want to revise the curriculum for doctors and nurses so that they can appreciate mental health illnesses. We want to work with the Peace Corps in the PAHO and the University of Guyana for a curriculum development consultant to revise our current curriculum. And of course, we're going to create group therapy sessions for survivors of suicide. Mr. Speaker, we have a societal responsibility to protect our children and young people, particularly those at risk of experiencing mental health distress. Raising awareness and prevention through education is a vital part of we at the Ministry of Public Health will become involved in. The area of focus listed needed the commitment of every person and institution represented here today. We need to create a tidal wave of support and policies that will effectively deal with the issues identified. As the Ministry of Public Health, we believe that suicide is preventable and that suicide prevention works. In order to accomplish our mission and goals, we will be using the public health model mentioned earlier, along with the media campaigns and education to raise awareness of suicide. We will be utilizing a strong educational approach to dispel the myths about suicide and let others know about the realities surrounding the national public health crisis. Mr. Speaker, it is important, imperative that individually and collectively we recognize that we are in a crisis situation in our country. Let us work assiduously to reduce and eventually eliminate, as far as we possibly can, suicide in Guyana. As I conclude, Mr. Speaker, permit me to say that as a result of the financial input from Budget 2016, the Ministry of Public Health is positioned on the brink of significant healthcare reform. At the Ministry of Public Health, we are committed to realizing the goal articulated in this year's theme, stimulating growth, restoring confidence, the good life beckons. We do recognize that we have inherited many negative components from the past administration, many of which have brought the health sector into disrepute. However, we only will look back with a view of correcting these ills, Mr. Speaker. The key issues have been identified and prioritized. Moreover, strategic programs have been formulated, relationships with relevant stakeholders have been established, and implementation processes will be rolled out using the money allocated in the 2016 budget. In summary, Mr. Speaker, the budget demonstrates in clear and concrete terms that we promise and deliver. What we say, we pay. And everything we do is done to benefit all the citizens of Guyana. Mr. Speaker, the Ministry of Public Health commits to ensuring that every Guyanese, despite your location, class, religion, or ethnicity, will have the access to quality health care that is characterized by efficiency and effectiveness. This is more than a promise, Mr. Speaker. It is a commitment. Mr. Speaker, as I sit myself down, when I was much younger, I used to play and sing songs fondly with my friends at the Bishop's High School where I attended. The game was, there's a brown girl in the ring. We all shout, show me your motion, before we tra-la-la. Today, I'm happy to report, Mr. Speaker, that the APNU AFC government was placed in the ring by the people of Guyana. The good people have asked us to show them our motion. We are doing just that with the budget 2016. Mr. Speaker, this budget is economically sound and methodically designed to benefit all the Guyanese people, including those on the other side. Thank you.